Welcome back to Drugs and Behavior with Dr. Gooden. We'll be talking about Chapter 2, Personal and Social Issues. Each year we spend in the United States approximately $25 billion on healthcare for either specialty services, behavioral consequences, or prevention of alcohol and illicit drug abuse. Healthcare costs associated with tobacco use add another $96 billion annually. Each year there are over 100,000 premature deaths from alcohol and illicit drug abuse, representing nearly $90 billion in productivity losses, or more than 3 million years of potential life lost. These numbers are far greater when you consider the number of premature deaths, productivity loss, and years of potential life lost as a result of tobacco use. There is not a consensus on which problems are most deserving of our efforts. Which drugs do you think deserve the most attention? I'm seriously asking. Maybe jot one down. And what's your reasoning for it? When we characterize a drug like heroin or cocaine as a bad drug, we are essentially saying that society has calculated the perceived risks of heroin or cocaine use against any potential social benefits. Heroin, like opium and morphine, is an excellent painkiller and has been used for medical treatment. But is it worth it? When deciding if a drug is a problem, our focus should rather be on drug behavior. Even when extreme amounts have been used as psychoactive drugs to alter the pH balance in the body. Even water in extreme amounts has been used as a psychoactive drug to alter the pH balance in the body and produce a high. As you may know, long-distance runners may elicit a runner's high. Drug toxicity refers to the ability of the substance to be dangerous or poisonous, or in some way interfere with a person's normal functioning. Every substance has the potential for toxicity if the dose is high enough. So we worry about drugs that are toxic at low doses. If the short-term effects of a particular drug can trigger a toxic reaction, then this drug is identified as having some level of acute toxicity. The dose-response curve is an S-shaped graph that demonstrates toxicity threat. The effective dose of a drug is different than the lethal dose. The lethal dose for 50% of the population divided by the effective dose for 50% of the population is called the therapeutic index. It is a ratio. If the therapeutic index is 9, you would have to take 9 times the effective dose to be likely to die. More commonly, the lethal dose for 1% of the population is divided by the effective dose for 99% of the population in order to provide a more conservative ratio called the margin of safety. Remember the term margin of safety and write out a description in your own words. The reality of street drugs is that the buyer has no way of knowing what he or she has bought until the drug has been used and it is too late. Frequently, street drugs are diluted or laced. The same lack of regulation causes danger with dietary supplements, as in the case of Dr. Oz. Data is collected from emergency rooms and local hospitals using the Drug Abuse Warning Network, known as DAWN. Drug-related emergency visits are reported as being 2.5 million in 2011, representing half of emergency visits. Many visits involve the taking of multiple drugs, which is referred to as polydrug use. Poly meaning many. Data is not collected for emergency visits due to alcohol alone unless the patient is less than 21 years of age. Consider the toxicity of any drug combined with alcohol. Most emergency visits are due to marijuana, cocaine, heroin, and methamphetamines. Notes: it is more common for drug-related deaths to be due to polydrug use. Opioids are the most frequently reported drug in a drug-related death incident. Cocaine and alcohol are in the top 5. Although medications to treat anxiety or depression are among the top 5, the amount ingested in these circumstances far exceed the recommended dosage levels and have been combined with one or more other drugs. Marijuana is unlikely to result in drug-related deaths and is combined with polydrug use. Methamphetamine is underrepresented in DON statistics that rely on metropolitan areas rather than rural areas where meth is significant public health concerns. Due to the number of deaths from heroin and cocaine being at the very top of the list while only representing a small number of users, their lethality is emphasized. In other words, pay attention to it. Club drugs and opioids have both been significant concerns in emergency drug-related visits. While acute means short-term, chronic means long-term. Chronic toxicity is most pronounced when alcohol and tobacco, which are legal, are causing the greatest adverse health effects on society. Let me repeat that. Chronic toxicity is most pronounced with alcohol and tobacco, which are legal, but they still cause the greatest adverse health effects on society. Chronic toxicity refers to the danger of taking a drug for a long time. Tolerance refers to the capacity of a drug to have a gradually diminished effect on the user as the drug is taken repeatedly. Over repeated administrations, a drug dose needs to be increased to maintain the same effect. Consider the effect of a cup of coffee on a coffee drinker as opposed to a non-coffee drinker. This illustrates tolerance of the drug caffeine. Behavioral tolerance illustrates the habit-forming potential and effects of a drug behavior. Behavioral tolerance helps us understand why a heroin abuser may overdose when they take a drug in a different than usual environment. And I'll ask you to pay attention to that. A drug taken in a new environment, even if it's been taken for years in your bedroom, if you take it somewhere else, it may have a more potent and even lethal effect. This conditioning that explains behavioral tolerance is also the reason that those in remission must avoid surroundings associated with their past drug-taking behavior. Even the environment may provoke a physiological effect. The environment may produce withdrawal symptoms that increase the chance of relapse. Dependence refers to the strong compulsion to continue taking a particular drug. It may be physical or psychological. Physical dependence is a model of drug dependence based on the idea that the drug abuser continues the drug-taking behavior to avoid the consequences of physical withdrawal symptoms, as if the foreign substance has become a normal part of the nervous system, and its removal and absence become abnormal. Physical dependence usually involves taking the drug to avoid the physical withdrawal symptoms. In psychological dependence, they crave the psychological effects of the drug itself or feel that they need the drug to function. Psychological dependence is a model of drug dependence based on the idea that the drug abuser is motivated by craving for the pleasurable effects of the drug. Usually there is both physical and psychological dependence at play. A catheter A catheter is a device that delivers intravenous injections of the drug in a free-moving human or animal, and it's used to research and study psychological dependence and self-administration of a drug with or without physical withdrawal symptoms. The Diagnostic and Statistical Manual of Mental Disorders is used to define substance abuse and substance dependence and substance use disorder. Substance abuse is when a person continues to take a psychoactive drug despite the fact that the drug-taking behavior creates specific problems for that individual. Substance dependence involves an individual with significant signs of a dependent relationship with a psychoactive drug. Substance use disorder is a more general term used in the DSM-5, referring to an individual with significant problems that are associated with some form of drug-taking behavior. Abuse and dependence are no longer differentiated. With regard to special circumstances, drugs during pregnancy are a big issue. What you eat, your baby eats. Increased risk for colon problems such as obstetrical complications, premature labor and delivery, or a loss of fetus through miscarriage or stillbirth are common. Physical malformations in the newborn, growth retardation, prematurity, low birth weight, or neurological damage. 26% of women smoke cigarettes during their first trimester, while 18% consume alcohol. 7% binge drink, and 8% smoke marijuana. An important issue is that these women may be doing things without knowing they are pregnant, and they are damaging their fetus. With regard to HIV infection, when needles are shared, the spread of disease is likely. Hepatitis is common, as is the spread of HIV. 1 in 6 injection drug users in the U.S. have been infected with HIV. That's 40% of those with HIV. Our taxes, yours and mine, pay for needle exchange programs for these individuals via the Department of Health and Human Services. Drugs are associated with violence and crime, but we cannot prove causality. Pharmacological violence is an act of violence committed by an offender who is under the direct influence of the psychoactive drug. Drug testing is normally done at the time of the arrest and cannot prove causality for the violence. Crack cocaine has a reputation for making the crack smoker irritable, suspicious, and inclined to lash out at another person easily. PCP, known as angel dust, produces an edgy manner and a social paranoia that may lead to violent behavior. Alcohol is strongly linked to violent behavior. Economically, compulsive behavior describes criminal violence as a result of the costliness of drug-taking behavior. The drug culture involves violence within itself or systemic violence, referring to the violence that arises from characteristic features of drug dealing, territorial disputes, selling inferior drugs, fraud dealing with the handling of funds from drug sales. And there are two categories of gangs, two main categories: outlaw motorcycle gangs and street gangs. Motorcycle gangs often trafficked methamphetamine, which is referred to as crank because motorcyclists would hide the drug in the crankshaft of their motorcycles. Many motorcycle gang members have criminal records. Street gangs are often comprised of teenagers. White and Hispanic gangs are less likely to be associated with drugs than African American gangs. Until about 1900, the U.S. took a laissez-faire attitude towards drugs, which means hands off, allowing people to do as they please. The Food and Drug Administration was formed in the Federal Bureau of Narcotics. The Marijuana Tax Act of 1937 placed a tax on growers, sellers, and buyers of marijuana, and state laws made possession of marijuana illegal. Since 1907, the Comprehensive Drug Abuse Prevention and Control Act classified drugs into 5 categories or schedules of controlled substances based on their potential for abuse. Schedule 1 drugs refer to drugs presenting the highest level of abuse potential, and Schedule 5 refers to drugs presenting the least level of abuse potential. Schedule 1 drugs have no medical use that is acceptable. The act ended the period that sought to end drug behavior through taxation. Prevention and treatment programs for drug abuse were set up, and funds were allocated for educational material. The emphasis shifted from penalties for using to penalties for dealing. The U.S. border with Mexico continues to be a drug trafficking route for cocaine and heroin, marijuana, methamphetamine, and illegal prescription medications. Afghanistan supplies 94% of the world's supply of heroin. The war on drugs was declared officially by President Nixon in 1971. Many experts in the U.S. suggest that tactics be changed from use reduction to harm reduction. I will see you in Chapter 3.